All right. If you've ever had a doctor say, let's try a shot, and you thought they were talking about tequila, this episode's for you.
Today we're talking about joint injections, what works, what's hype, and when you should actually consider one.
And we brought a real-life expert. Dr. Leyen Vu from Samaritan Athletic Medicine joins us to break down everything from cortisone to PRP to stem cells.
Stick around, because by the end of this episode, you'll know when to roll up your sleeve and when to roll your eyes.
All right. This is The Pitch. What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch. All right, welcome back to the Pitch Podcast. I'm Dr. Jason Young.
Oh, I'm Dr. Kathy Lynch.
Oh, are you?
Yeah.
Did we catch you by surprise
sorry.
there?
Just
Great.
woke up.
And I'm really excited to introduce our guest today, Dr. Leyen Vu. Dr. Vu is a doctor of osteopathy, and he works at Samaritan Athletic Medicine with Samaritan Health here in town, and also one of the doctors for the Oregon State Athletic Department.
Yes.
Go Beavers. Okay.
and Beavs.
That's where I know Dr. Vu from. And I was like, hey, man, you got to be on my podcast. And he said, what? And now look, here he is. Yeah, so, no, we're really glad to have you here.
Glad to be here. Thank
your
you.
specialty is sports medicine.
It is.
And we hear that you know a lot about injections. You do them.
Yes,
Okay.
we do. It's a big part of our practice, part of my practice. And so happy to come here and speak with you guys about it.
Sweet. Love it. Because we get questions about it all the time.
Yeah.
Yes. But first, let's talk about this podcast that we've been doing.
let's
things
talk
are going pretty well.
Mhm.
Yeah. So we want to thank all of you who've been tuning in, clearly from all over the world. We love you everywhere, all over the world. We really love our local people. So no. But did you know there's this weird feature on YouTube where it will actually dub our voices into different languages?
I did not know that.
Yeah,
Is that AI?
It does. Yeah, I think,
okay.
So I've heard the Pitch Podcast in Dutch.
Seriously?
Yes, I've heard it in German. And so, if you're really, really bored,
Yeah.
like it's a great thing
Be
to
real
listen to.
bored.
Change your life. So, and then as always, feel free to hit us up on our swag store, right?
Mhm.
I'll put the link up here. It's pitchpodcast.shop/swag. You can get yourself a sweet shirt. The holidays are just right around the corner. We're not running any Black Friday specials.
No.
And so you should definitely get yourself something. All right. That's enough of that.
Okay. Back to business.
Yes. Dr. Vu.
Yeah.
Why do you do what you do?
No, it's a lot of fun, Dr. Young. So it really, my interest in sports medicine kind of evolved, right? As a young child, and teenager, I was involved in high school sports and stuff like that, and saw the benefit of what sports could do to an individual.
Yeah.
and
What
vice
was
versa.
your main sport?
Yeah.
I did football and baseball.
Okay.
Yeah.
Oh, man, I thought that you were like basketball.
Yeah. No. They breed them taller for that. So,
All right.
but yeah. So so the interest started there, right?
Okay.
So, and then as I went through school, got interested in medicine, and as you guys know, there's different types of fields that you can go into, and I was really drawn to the tactile part of medicine, things that you can touch, feel, and see. So as opposed to more of the cerebral types of specialties, so it kind of gravitated towards the orthopedic side and the sports medicine side.
Did you go to DO school because you couldn't get into PT school or chiropractic school?
Pretty much.
That joke works every
It
time.
does every
It
time.
works every time. Yeah.
No, in all honesty, actually, as I went through school, I was like, oh my gosh, the part of osteopathic medicine that was about, looking at anatomy and function, the interplay of the two, and getting a lot of education early about anatomy and function really probably catapulted my career to go into sports medicine. So I think that had a lot to do with it.
Well, I think, and I think a lot of people don't understand that because these days, when you see DOs and MDs working, a lot of them are in mainstream medicine.
Absolutely.
And those degrees are kind of interchangeable. Like we had Tyler early on. He's a cardiologist. He's also a DO. So people are like, well, why didn't you become an MD? And it's not because like you weren't smart enough to become an MD or anything like that, but it is a bit different focus. It's a little more physical medicine and everything like that. So,
and there's, and you hit it on the head. A lot of MDs and DOs are now working alongside each other. The curriculums are becoming more and more similar, but there is, from the osteopathic side, a stronger emphasis on anatomy and structure and function, like I talked about.
Yeah,
so
you're going to give me an adjustment later. Yeah.
Not as good as you could do.
Okay.
So.
Shoot, I wanted to see that.
Oh, goodness.
Yeah.
So, real common questions that we get is about injection.
Yeah.
Right. We see patients who have knee pain and shoulder pain and stuff like that. And all the time we have patients who are coming, they're like, hey, my doctor thinks that I should get an injection.
Right.
And for some stupid reason, people are asking us,
what should I do?
Yeah. So I'm really excited for this episode because I'm excited to learn from you about some of these things. So now I know what to tell patients. I'll probably just show them the episode. But yeah, so it's a very, very common question. Sometimes people are coming to us because they want to avoid an injection.
Sure.
But there's other times when it's probably the best thing that they could do.
Absolutely.
Right?
No doubt.
So how did you get interested in doing injection therapies?
So it is, and I want to be clear, it's the injection part is just part of the one tool or in the toolbox.
Part of the full kit,
And I think that the services that you guys are doing is as important, if not our first line. We said, hey, let's emphasize the importance of doing the rehab, right? Empowering yourself in doing the exercises to get to really address the pathology where you have direct power and ability to improve your condition.
Yeah, you got to freaking move, people.
Right?
Exactly. Language,
yes.
So a lot of times the injection part is another tool, and I use it really as a way to get you to be able to do your rehab.
Yes. And that's kind of funny because that's maybe something that you and I have in common is both of us are doing things that help them to get to what she does.
Right.
Yeah,
exactly.
Like when people come in and they're like, oh, I'm stiff and I can't move. I tell them, I'm like, listen, I'll give you an adjustment. The adjustment is not going to last you. Like this is not a cure for your life.
Right.
You'll get adjusted. And my purpose in adjusting you is so that you can then rehab, right? So same kind of thing with injections. Like you can get all the injections you want, but an injection maybe kind of, my understanding of it at least, is it provides a window where you can now rehab and develop stronger muscles, more stable joints and everything like that so that you can avoid having to do the next step, which is eventually we have to find somebody who cuts people open.
People are
Yeah.
I think you're hitting it on the head right there, right? So I generally tell people that we have to look at it as what's the purpose, right? If they're coming in and just asking for an injection kind of willy-nilly, why? Because you're hurt. I say, well, let's get granular. Let's say, what is the purpose right here, right? So if it's I hurt too bad, I can't do my rehab, I can't, I can't function. Okay, I think that's a good reason. If another one is like, hey, I have this event in X number of weeks, whatever, and I want to be really functional for that. Okay. I have this game or I have this competition or whatever, right? And so once you look at it through that lens, then it kind of makes sense and you kind of tailor the different types of injections for the purpose that the patient's trying to achieve, right? And so again, this is just a part of what we do, but focusing on the musculoskeletal side of non-surgical sort of medicine, it's a big part of what we do.
Yeah.
That's usually how I'll try to sell it to the patient too. Like, should I get it?
Yeah.
Yeah. And I say, well, you're probably going to be able to do your home exercises better.
Right.
Mhm.
Right.
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 That's usually like, oh, really? Yeah.
Right.
Yeah. But you still have to do your exercise.
Exactly.
I'm usually trying to
Exactly.
tell them to hold out for the surgery.
Yeah.
No, let's see. Let's
No,
cut that
yeah,
knee out.
right.
Right? Yeah. I mean, the knee's the
Cut it right out
problem.
of- yeah.
Let's just cut it out. Give
Yeah.
me a robot.
Let's just wait for it, right?
Get the model with Bluetooth, right? And the hotspot. So,
No.
yeah.
And so,
Well, should we go over the different types
Sure.
of injections?
Sure.
Let's start with cortisone.
okay. And so there are, so cortisone's probably been around the longest and is still the most frequently used.
Mhm.
And so when you look at cortisone, right,
Mhm.
it is the strongest anti-inflammatory that we have.
Mhm.
So it's delivering a steroid or a
Right.
strong anti-inflammatory locally to the area of pathology,
Mhm.
right?
Mhm.
So that's the benefit. So I tell people if you have an inflammatory condition that would benefit from taking that anti-inflammatory locally right there,
Mhm.
I think a cortisone injection is not a bad place to start. Okay,
Right.
it's one of the fastest things that acts, right?
Mhm.
So we usually mix it with either in a local anesthetic or some
Okay.
saline, right?
Yeah.
I like to
and-
mix mine with honey butter.
That-
Yeah. Yeah. Yeah.
How's that going?
Delicious.
Yeah. So you get a numbing effect from the anesthetic, and then
Mhm.
cortisone. Cortisone, it in terms of onset of action, sometimes it's almost immediate. Sometimes it takes a
Mhm.
couple weeks to really kick in, or to
Well,
start kicking.
Where does
Yes.
cortisone come from?
Well, synthetically made, but it is if you guys remember, right, the whole inflammatory cascade,
Mhm.
right, and so it is a synthetic hormone that blocks the inflammatory cascade fairly high.
Yeah, it's like synthetic cortisol, right?
Exactly,
Yes.
exactly,
Yes,
right, right.
like straight
exactly.
from the adrenal glands.
Oh gosh, yeah,
Okay,
right. You
now
know,
you're
Yeah,
getting-
let's
yeah,
go through the whole
Okay. Yeah,
PTA
go ahead.
axis
Go
right
for
now.
it. Go
God,
for it.
it's impressive.
Yeah.
And so it's strong, right?
Mhm.
The benefits is it's fairly quick acting.
Mhm.
On average, different studies will say different things, but I generally tell patients that it is I look at it as a bell curve, right? Most
Mhm.
patients, if you look at the peak or the middle of the bell curve, it is that they're getting about 2 to 3 months of relief,
Yeah.
right?
Okay.
Mhm.
On the ends, on the tail ends, outside of the standard deviation, right?
Mhm.
You get months to years, or
Mhm.
months to years, and
Right.
then weeks to months on the
Okay.
on the shorter
Right.
end.
And that's because some people just need to break that inflammatory cycle.
Mhm.
And once they do, they're just going to
They're good.
complete that,
Right.
Right.
that healing process.
But
Right.
to your really statement,
Mhm.
Lynch, is like it's the big thing is that I tell people you utilize this time that you feel good.
Yeah.
Don't to do your rehab,
Mhm.
to do your exercises, to be active, to achieve what you want to do.
Right.
Don't say, "Oh, I feel good now," and kind of put that to the wayside.
Right.
Yes.
Oh, he fixed it. He fixed it.
Fixed.
Yeah, that man
Yeah.
with his needles, he did it. Yeah.
So the negative part
Yeah.
is that, and this is mainly in vitro and animal based research,
Hmm.
that it can be chondrotoxic,
Mhm.
Okay.
right? So wearing down of the cartilage,
Mhm.
and then wearing down of the tendon if you're if
Mhm.
you're injecting into a tendon.
Dang
Okay.
it. I knew it. No.
Right?
just-
Right? No,
yeah.
there's no free
Yeah.
lunch in life.
Yeah.
Yeah.
Right.
Of course.
And so you have to weigh the risk and benefits of each
Mhm.
of those, right? And
Yeah.
so once again, it's no free lunch.
Right. Well, and I thank you for sharing that. I think that's really good. It's
Mhm.
important for people to hear it because sometimes people come in and they're like, my doctor wants to give me a cortisone shot and I don't want that poison in my body. And I'm like, well, bad
Whoa.
news. Yeah. Bad news. Right. And then also, especially in the world of like menopause, people are like, cortisol is the enemy. And it's like,
Yeah.
it's a very important hormone.
Mhm.
And I think that it's kind of the case with, well, I'm looking at all these and it's really redirecting mechanisms that already exist in our body and deploying them at like a specific problem,
Exactly.
which is kind of cool. So yeah, I slipped one in there that maybe isn't in that category, but like the gel injections. Can you talk about that?
Yeah.
Because that's become, I think, I'm seeing that more and more with patients who are like, yeah, they shot some gel in my knee.
Right.
Yeah.
And they're like, what's the gel? And I'm
Yeah.
like, so how's your dog?
Yeah.
Because honestly, this is probably the one that I know the least about,
Right.
but it's really fascinating. So break it down for us.
So it's not hair gel, number one. Right? So just get that clear. This is off the bat.
Then
I can't move my knee.
Yeah.
Oh, it's because you got hair gel in there. Yeah, it's got amazing hold.
Yeah, right.
Yeah, but it's got so much
Screaming
body,
hold.
dude.
Modern
Yeah.
So right.
And sheen.
So gel is like we like to call it because it's that one's easy to remember, right?
Okay.
Mm-hmm.
But it is hyaluronic acid, or the other term that you'll hear thrown around is viscosupplementation, right?
I like that.
But it's hyaluronic acid is the protein.
Okay.
And it's a protein that is found in the synovial fluid or the fluid inside your joints.
Okay. So it's already there. Also,
It's
we are
there again.
taking stuff from the body again.
Right.
Okay, good.
But,
All right.
but this is also synthetically made as well.
Synthetic.
Right.
All right.
Right.
Mhm.
And so the idea.
So poison.
So I wouldn't go that far. But
No.
But so it is the idea there is that it is a protein that is found within the synovial fluid or the fluid around your knee to help lubricate
Okay.
the joint.
Mm-hmm.
And that's where we think the benefit comes from is the
Okay.
lubrication. Okay. And the studies, we thought that when it first came out, it was going to be the holy grail, right?
Mhm.
Oh my
Yeah.
gosh, this is going to be, and like anything else that comes through,
Yeah.
the scientific process, right? Everyone's
Right.
excited about it. And then
You're like, no honey butter required.
Right. and then, but then we found that the efficacy in it isn't probably as great as what we thought we were going to see.
Mhm.
So it is beneficial in the fact that it probably gives you a little bit longer relief than corticosteroids or cortisone shots. It takes a little bit longer to kick in.
Mhm.
Okay, about a couple 2 to 3 weeks to kind of kick in. But it doesn't have the negative effects of breaking down your cartilage or your tendon or the structures around a joint.
Cool. So you're kind of limited on the number of cortisone shots that you might get in a joint.
Yeah.
Yes.
I can do gel for days.
Yeah, if you wanted to.
Yeah.
But and so the typical thing we say is, this is sort of dogma, but in a weight-bearing joint like your knee, your hip, or something like that, we want to limit cortisone to 3 to 4 times a year. Now, that's quite a bit.
Yeah.
And that was something
Yeah.
that we kind of said way back in the day. I've
Right.
become a lot more conservative with it,
Mhm.
and because of the effects that we're finding
Yeah.
from it, right? But the gel injections don't have that effect, and so really what it comes down to is, unfortunately, other things in medicine, American medicine is insurance, right?
Yeah. What?
So yeah,
We never talk about insurance on this
What?
show. No.
I know,
Great.
Right.
So so right now, the coverage or even FDA approval and insurance only cover the gel injections for your knees.
Mm-hmm.
It's not covered for your hips, your ankles, or anything like that. And that's partly because the data isn't
Right.
as strong for those joints. And so right now it's just for knees, and I'd say the vast majority of insurances are allowing it once every 6 months
Okay.
as the most frequent.
Which probably is pretty good,
Yeah.
right?
Yeah.
Because I think that I see people get
Mhm.
about that much mileage out of
Right.
it.
Yeah,
Yep.
yeah, and that's
Yep.
and so we always got to take that into account too.
Yeah.
Right?
So asking for a friend though, like if
Mhm.
I wanted to just like, let's say I wanted gel injections in my ankle, like could I get gel injections in the ankle, and how much would it run me? Yeah.
Good question.
I mean, you don't have to speak for Samaritan Athletic Medicine. But
Yeah.
Give me a ballpark. Like, is somebody looking at thousands or hundreds?
Yeah,
or-
that's probably if you're talking about buying it from the distributor, and
Mhm.
oh man, and
I get mine behind Dairy Mart.
So
There's a
is-
guy. There's
so
a guy.
wait, is that lactose or lactose free?
Yeah. My
So-
contact. His name is Bandit. Yeah.
Yeah.
So
No, it and that's the challenge that we have,
Mhm.
and so and some of my colleagues from other countries, they're saying, hey, it's so much cheaper, let's say in Canada or something like
Yeah,
that.
you get the spicy gel injections, right?
Yeah.
Mhm.
So it's one of the things, that unfortunate part of our system, right? Is the cost.
Yeah, it's funny. I've always thought about that because usually in my practice, I usually see the gel
Mhm.
in the knees, and I didn't realize it's, of course, it's insurance.
Yeah.
But also, so we don't have a lot of data on like shoulders. I've seen some pretty old shoulders
Shoulder.
that
Could they think it would
Yeah.
benefit, right?
Mhm.
But I'd say that the data there, just the data is not strong
doesn't
Okay.
support it for
hips,
hips.
glenohumeral joints,
Okay.
and
Mhm.
shoulders and ankles. It's just, and then again, right? It was something that we thought the data initially was pretty strong for
Yeah.
for the knee, but then as
Mhm.
more comes out,
Mm.
it's like, oh man, is it as beneficial as we thought it was?
Okay.
Right.
So
Okay. Maybe placebo.
Yeah.
We should do an
Mhm.
episode on that.
Oh, wait. It's one of our most popular episodes ever, Kathy. So, but I will say, though, that there are some of these injection therapies where, there is a significant placebo effect because this is an easy one to do placebo with. Like, I can stick you with a needle
Mhm.
and, like, in a test situation, you don't have to know
Mhm.
what's necessarily in there. So, there is a bit of placebo effect that's associated with any of these.
Oh, absolutely.
Yeah.
Yep.
And like with
No
any
doubt.
therapy,
No
if,
doubt.
I've seen cortisone is very powerful steroid, very powerful anti-inflammatory. I notice that people who have the worst attitude about having to go get a cortisone injection, they tend to be the ones who have the worst
Yeah.
outcomes
Yep.
with it.
Yes.
So
I
it's
think
a
that
crazy
goes.
thing.
I think that goes along with a lot of medicine, right?
Yeah, absolutely.
It's sort of the what was it? We always call it the pre-test probability, right?
Yeah,
Right.
yeah.
You coming into it,
Mhm.
if patients are like, hey, I don't want this, or I don't want, well, plus we don't force anybody to get it,
Yeah.
right?
Right, of course.
But if they're like,
Hold
oh,
them down.
this is
Yeah.
hold it, right? They're like, oh, this is not going to work, whatever. Then
Mhm.
Yeah.
chances are, I mean, it probably won't, right?
Yeah.
But
Yeah.
Yeah.
so because so much of it, because you were measuring a subjective outcome, right?
Yeah.
So we're measuring it by how much pain relief have you gotten.
Hmm.
Well, that's a subjective measure.
Yeah.
So
Totally.
Well,
Totally.
part of cortisone too, like if it doesn't work, it's kind of diagnostic for you too, right?
it
It
can
can
be,
be.
and so I actually think that the anesthetic is probably more so, right? Because it's
Yeah.
so quick.
Mhm.
Oh, yeah,
But
yeah. Mhm.
but so I tell people this a lot of times. And I said, hey, listen, like this injection is both diagnostic and therapeutic.
Mhm.
We could just do the anesthetic, right?
Yeah.
Mm.
But then if it works, then you have to come back
Yeah.
for
Do a second
for
injection.
a more whatever injection it's
Yeah.
going to be.
Yeah.
It's another injection that gives you longer relief, right?
Mhm.
So since we're there, like,
Let's just do it.
which one would you rather?
Yeah.
Which one do you want to try?
Yeah.
And so
Yeah.
Well, and it limits the risk too, because I mean, the only thing safer than 2 injections is 1 injection. Right? Yeah.
good point.
And again, just like I said with placebo is in everything, there's risk in everything too. So it's
Yeah.
not like injections tend to be very safe,
Yeah.
right? Very good safety record, but
Right.
there's always like weird things that can happen. And so
Absolutely.
yeah, you want minimum intervention for maximum effect.
There you go.
Yeah.
Mhm.
Well put.
Mhm.
Okay, so I think my favorite on the list is probably PRP,
Hmm.
the platelet-rich plasma.
Mhm.
And I say it's my favorite because it's one that's made a big impact for me.
Yeah.
Guys, I'm a survivor of PRP.
Tell us.
I am.
Tell us.
Yeah.
More.
Yeah. Scott, is there like violin music that we can cue? No, we don't have that? Okay. Yeah, we didn't buy that package
Mm-mm.
here.
Did you tear a hamstring?
No.
Doing your sit and reach?
Okay, here's the story. So Corvallis, Oregon is a very bike-friendly place.
Okay.
And so at one
Yeah.
point in my practice, when I was like, you know what? My life is just so uncomplicated. I'm gonna start adding a level of difficulty, and I'm gonna start biking to work every
Okay.
day, right? And
Commute.
so I was biking back and forth, and then one day I biked home for lunch, and then I was biking back to the clinic, and I see dangling from my handlebars a spider, like a big fat
Right.
spider, and I decided in that moment one of us is going to have to die, right? And it wasn't going to be me. So I'm doing combat with this spider. I finally kill it. By the time I look up, the curb is like 3 feet away from me. And so I'm like,
Oh.
if I hit this curb, I won't be able to practice. And so I decided I'm going to bail. There's a nice, like, soft embankment of grass. So I bailed, aimed for that, landed on it, on my shoulder, sprained my AC joint,
Okay.
which is maybe one of the worst joints that you can sprain if your job is to push into other people's spines all day
that
long.
would hurt.
Yeah, so I had a pretty good AC joint sprain, and yeah, it didn't feel great at all. It was horrible, and but it didn't need surgery. What it needed was rest. You just got to let that joint heal up. But I couldn't do that. I was hustling. Like I own a business. That business requires me to be in it working, and so I was just going through banging my AC joint all day and suffering. So I had a really good friend who she does a lot of injection therapy up in Portland, and she was like, you know what, come on up, I'll get it taken care of. So she did some PRP injections into my shoulder. She said, here's the injections. Now you need to take about 2 weeks to really let this set up. And so I was like, cool, thanks. And I went back to work the next day. So, but
Mandy said, get back.
Despite the fact that I'm a horrible patient, it really was effective for me. And so can you tell me why? Can you tell me what she did to me? And can you tell me like why that was useful?
Absolutely. So, that's awesome, by the way. That experience. And it's probably not advised to start working, less than 24 hours afterwards. But So PRP stands for platelet-rich plasma, right? And so the idea is isolating the platelets that and we're beginning to understand more and more, right?
And for the listeners, platelets are just very small plates that are in our body.
Right.
Yeah. So what's a platelet?
Platelet is is one of the cells in your blood that is primarily its function is to help clot and stop bleeding.
They're sticky.
They're sticky.
Yeah.
Exactly. But one of the other really awesome things about them is that it is a great recruiter. So it releases a lot of these little molecules that recruits all these different types of cells that come here and help with inflammation, help with healing. Okay.
So the football team could use some platelets.
Yeah, they have a lot of NIL money.
So no comment.
So So the thing is that it's at first the big, like I was talking about, like the big excitement before it was like, okay, this is gonna help regenerate, and this is in this umbrella of what we call regenerative medicine.
Yes.
But really, one big take home point is that I want our listeners to know that the PRP and other things, we'll talk about stem cells later, right? Right now, the data is not, the science isn't there that we're actually regenerating tissue. Okay. So this is what we call, there's a term a lot of us use, is that this is symptom modifying. So it's improving symptoms and structure modifying, and function modifying. So pain and function modifying, but not structurally modifying. So you're not, and I always say this, right? You're not making a joint or a tendon become 18 years old again, right? So you're not regenerating things. So
it's like a guided healing process.
It is. It is. But I also am careful about the term healing, because people hear healing, they say, okay, well, you're regenerating. No.
Yes.
It is
not a guided curing process.
Right.
Yeah.
It's changing the environment around that tissue to facilitate to change the environment so that it is it's less painful and more functional. Let's just say that. Okay. So the process is you take your blood, usually it's just from your elbow or somewhere, a vein that's easily accessible. You and you take whole blood out. You then put it in a centrifuge machine that just is fancy for a machine that spins.
Right.
and you separate the platelets. So you really want to get a concentration of the platelets itself. Okay.
Mhm.
And you take, and then with that separated platelets, then you inject that into the area that is giving you issues, right? Or
Right.
you have disease there.
Yeah.
Okay.
Mhm.
And again, I think the big thing that people need to know is that it then recruits all these other cells that help with the healing process. And another term that we use a lot of times is, because a lot of people do this for chronic issues,
Yeah.
right?
Yeah.
Yeah.
You're trying to make a chronic process more acute, meaning that after a tendon, or let's say a joint, has been chronically diseased, right? There is the milieu, or the environment there is not conducive to healing,
Right.
So you want to kickstart sort of an acute process
Yeah.
again.
Your body's like, meh.
Yeah, we're done.
Shut up.
I give up,
Yeah,
right?
Yeah.
we're
Shut
done.
up.
Yeah.
We're done with
Yeah.
you. Yeah.
And so and so that's the whole idea from a 30,000 foot
Yeah.
view, right?
Yeah. That's helpful.
So, yeah.
What conditions do you think, oh, this is going to be, PRP is going to be perfect for this?
Okay. So if you want to look at sort of the science and how it evolved, right? I think one of the places that it started is looking at tennis elbow. Okay.
Yeah.
So lateral epicondylitis for others that know of as that, that's the
Yeah,
medical term.
nerds. That's how you say it.
Right,
Yeah.
Mhm.
And so, but even that's right, is lateral epicondylosis, because
Yeah.
there's very little inflammation there, right?
Arthritis, yeah.
So anyway, so tennis elbow is a common, and it's been well studied for that, right? And then initially, the data came out. It's like, oh my gosh, like PRP is very effective for this, right?
This is it.
Is it right?
Yes.
And as more data has come out, it's a little bit more tempered, but it's still seen as a good option, especially compared to, let's say, cortisone, right?
Yeah.
Okay,
Yeah.
injections. Other places I think that is really helpful is there's been a lot of data on knee arthritis.
Really?
Okay.
Yeah, specifically knee, mild to moderate
Okay.
osteoarthritis.
Okay.
So data's been it's been robust. So there's a lot of studies out there, and
Okay.
it's been pretty effective. Okay,
Okay.
Right.
especially looking at it head to head with cortisone.
Okay.
Right.
It's not as it doesn't kick in as fast as cortisone does. Like I said before, cortisone is
Yeah.
one of the fastest we have.
Right.
But you look at 6 months, 12 months, 2 years, PRP generally outperforms
Sweet.
corticosteroids
Nice.
Yeah.
comparatively. I'm not saying that it'll last that
Right.
long,
Mhm.
Right.
but looking at head to head in the
Right.
studies.
And I would add anecdotally, it is great for AC joints injured by spider attack.
Yeah.
Right. Yeah.
Well, how fun was it going in though?
Darn near a cure.
When-
What?
when
Oh,
she
the
put it in,
injections?
yeah.
Okay, yeah.
Yeah.
I will say
let's tell
PRP
the truth.
injections
Yeah.
do not feel great.
No.
No, they don't.
Yeah.
The best part of it was the blood draw. That was fairly painless. But yeah, the injections, well, and a lot of these therapies, like prolotherapy, will just kind of skip over that. But, it's like one of the values of prolotherapy where you're injecting like sugar water.
Sugar water, yeah.
Yeah, so I guess we're getting into it now. But one part of the value is that you're creating some irritation and inflammation, and you're causing a healing crisis. That's the word that they love to use with us in chiropractic. So, I'm causing a healing crisis. It's great. But our body has a mechanism for healing, and it basically consists of drawing attention to something.
Yeah.
And you see that with an acute injury. You also see that with a virus, right? Because your body's response to a virus is, I'm going to mark this and draw attention to it, and then the rest of these functions, they just go and they attack it. And I think that bodies are really pretty amazing because there's lots of little ways that you can kind of tweak this principle that ends up working in a person's favor.
Right.
Mm-hmm.
So yeah, really neat.
So going back to your AC joint, right? The hard part there is like, is that because of that system you're talking about, our bodies being amazing and taking care of it. The question, we always, again, like I said about injections, say, hey, what's the purpose?
Right.
Yeah.
Is it, are we trying to get Dr. Young back to work faster? Or
Mm-hmm.
by doing the PRP, is it going to help with the healing process that you'll get a better, more complete outcome? Let's say,
Right. Like a more stable joint.
Yeah,
Yeah.
and that part it's been difficult to kind of say,
Yeah.
okay, well, PRP speeds up X, Y, or whatever disease process that we're talking about, especially if it's acute,
Yeah.
as opposed to just letting the body do what it naturally does.
Mm-hmm.
And so that's one that has been a tough one to outperform, right?
Yeah.
But we do it frequently for that for that reason too.
And I think a lot of these things go that way because you start with your initial studies and they tend to be smaller studies.
Right.
And then that treatment gets deployed and then you get much more data just by seeing how it exists in the real world.
Yeah.
And so,
Right.
and I think that, with evidence-based medicine, it doesn't mean that just because something has moderate evidence that it can't be effective for an individual.
Right.
Or just because something has pretty strong evidence that it is definitely the answer for somebody.
Right.
So,
Exactly.
yeah, it's an N=1, right? It's everybody is their own study. So, all right. What about stem cells? What can you tell us about that?
So stem cells is a sort of also an umbrella term, right?
Okay.
And we'll hear stem cells, and and once again they think about regeneration of tissue.
Mhm.
And what we have found that again, the science isn't there yet, right?
Mhm.
So let me just
First of all, what is a stem cell?
So
Yeah.
so the whole idea of stem cells, right, is taking a cell that is not quite differentiated, meaning that what that means isn't destined to become a certain cell type yet.
Okay.
With the thought of injecting it into a certain location and then making it become that type of
Mhm.
tendon or cartilage cell, right? And we have found that is, at least where the science is right now, that is not is what's happening.
Gotcha.
Right?
Mm-hmm.
We're finding that these stem cells, or I don't like calling them that because it has that connotation that right? These cells are having this similar effect as the PRP is that these cells have the ability to recruit other cells to help with changing the environment and with helping with the healing process of that location. And so we you hear a lot about the marketing about, okay, you get these stem cell injections and oh my gosh, you're going to be back and you're going to be flying and whatever, and so we have to be
growing
careful.
you a new knee, LeBron.
Yeah. And so we have to be really careful about that,
Yeah.
right? I think that's one thing that is probably another take home point is looking at is really looking closely about what what people are saying are the objective of what they're injecting.
Right. Yeah.
There's a lot of different types, right? They can get it from your fat cells. They can get it from
I have a
bone
good
marrow.
supply of stem cells, actually. So if anybody's interested in stem cells, just hit me up after the show. Okay. Anyway.
So then umbilical cord, and
Right.
so it's just I just caution our audience to be a little wary of and be really critical of, and just ask the questions about where you're getting this from and what are you saying is that the expected outcome.
Yeah.
Yeah.
Yeah. Gotcha. Yeah. Because could you use stem cells to grow an extra arm? Because I could use an extra arm sometimes.
Yeah.
Yeah. Like if you just get enough of them close enough to an arm, they'll be like, look at that. Good arm. Yeah, let's do that.
Why stop at a third?
Yeah, right? I know. Well, I just want to try out a third one, see if it's useful. Then,
go from there.
Yeah, it's kind of like that movie Multiplicity, right? Oh, it's such a great movie. With who's that? With Batman.
Michael Keaton.
Yeah.
Oh.
Uh-huh. Hey, Steve.
So it looks like he's already busting some myths for us.
Yeah. Should we
PRP
play?
and stem cells don't. Are you ready?
Oh yeah.
For a game?
Yeah. We could go do that and then
Go do
I'm
that and
I'm gonna find the game.
we'll come back.
I'm gonna find the game.
Okay.
Yeah.
You already kind of talked about PRP and stem cells are regrowing cartilage.
Yeah.
That's not. That's a myth.
False.
False. We talked a little bit about cortisone destroying joints. That's
I
not
remember that.
100% true.
So it is, I think destroy is a pretty strong
word.
term there. Is it healthy for the joint? I think is no, right? It is. That's why I want to limit the number of injections into joints.
But it can definitely be useful.
Yeah,
it can. Yeah. Yes, definitely. Right. And so and it is, I'd say this destroys a strong term. Yeah. It's not great for the joint. It's not healthy for the joint. And is it useful? Yes, it can be for in the right context. And just be mindful of how many times you're doing it.
Right. Right.
Let's see.
But of course, cortisone's always approved by insurance, isn't it?
For the most part,
yeah.
It depends where you're injecting, but it's.
Well, and I think it goes back to the very first thing that you said about cortisone, which is that it's been used for a very long time.
Yeah.
And so there's a lot of data out there, and the cost of producing cortisone is, it's not super expensive process, and so I think that probably explains that.
And we've only talked about the injectable type. There's like oral types that treat a myriad of conditions, and it's extremely powerful. It really is. And so I think I'd be doing a disservice to say, oh gosh, this is terrible. No, that is not the case.
Right. So what's your favorite flavor of cortisone? It's watermelon, right?
What's that?
It's watermelon? No.
Depends on the season.
Yeah. Well, I want to ask this next one for you, Kathy. You should try injections before physical therapy.
I would say myth on the. Well, so again, if we are making a conscious effort of understanding what we're doing and why we're doing it, I don't think there's a wrong answer out there, but right for the right situation. So, if you want to talk about a blanket statement, you should try injections before physical therapy. I don't do that, and I generally like to start with therapy or even chiropractic. What modalities first, right?
Yeah, right.
With that said, if you're in so much pain that
heck yes,
other modalities are going to be ineffective for you, then let's try this so that you can get into and do your rehab.
Yeah. Well, and I think it's a good selection process for who that's going to be good for, for a couple reasons. Because number one, if you can, I don't think it's just because exercise is what physical therapists do or adjustments is what chiropractors do. It's the thing is, if you can find something that is low risk, that especially with exercise, that's self-directed and so empowering, that's huge, because it's not just helping you through this problem; it's giving you tools for how to live your life. And then if you can't get it done that way, I think those are people that are going to tend to have a better outcome with an injection.
Right.
And that's because of all the reasons, what the science says, the placebo, I have confidence that I've done everything that I can for myself, and this is the next step. And I think all those things go into it. So
I want to say too, the whole stem cell thing, it's a hot button topic right now. And I don't want to say that yes, I said that the data is still emerging, right? I think that it is sort of the future in terms of when we find that, and where I think it's gonna take off. It actually already has, and there is some applications for it right now, right? Like I said, I don't do a ton of it, right? But it is, I've seen some benefit, right? And so it is, and so I guess I want to be fair to.
You busted the myth. The next one we were going to ask, which is stem cells are useless.
But stem cells and PRP is not always covered by insurance either, right?
It is not. Well,
it wasn't when I got PRP.
Yeah, I had heard that, and gosh, I got to look it back at again, but I think that one state might be in one insurer might be starting to cover it, but for the most part, it is not.
Yeah.
It's not covered. No,
Yeah,
it's
so
not
it's out
covered.
of pocket,
It's unfortunate.
which is really unfortunate.
That's usually
especially PRP.
That's usually my compass for knowing if something actually works or
Yeah.
not. Is does insurance cover it? Oh, okay. It does. It doesn't. Oh, okay. Then that's
so
useful.
you should get that. Definitely.
They are behind quite a bit.
I'm just going to make a statement. What I just said is not true.
Yeah.
Okay. Insurance covers
This is for entertainment
useful
purposes,
things.
by the way.
Yeah, and that's right. Disclaimer. We're so bad about that.
Yes.
Yeah, nothing that we're saying here is true. Go talk to your doctor.
Yeah.
No. The thing we're talking about real stuff, but definitely we're not your doctors. Well, some of us aren't your doctors,
Yes.
and so yeah. But I do think it's time for a game.
Okay.
Sure.
Okay.
Let's go.
Now we're going to call this VU Sports Trivia. Now, the reason that we're calling it VU Sports Trivia is I just think your name's fantastic to say. I love it.
Thank you.
I love it. So, yeah, congrats and thank you to Mom and Dad Vu. So
I'll make sure to tell them.
yeah. So because you work in the arena of sports medicine, it's just going to be sports trivia. You've talked to us a lot about medicine. We appreciate that. So let's do some sports.
Yes,
stuff,
Okay.
sports.
All right.
All right.
Sports.
So very simple. I'm going to give you a question. You just give me the answer.
Okay.
All right. So what sport originally called mintonette was invented in 1895, which I will say is also the same year that chiropractic was invented.
Oh.
1895. Mintonette.
Mintonette. I'll give you a clue. The net is kind of a clue.
Yes. Mintonette.
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 Mhm.
Okay.
And I'll tell you, it was created as a lower impact alternative to basketball. So it was a joint friendly sport.
To basketball. Okay.
Yeah.
Okay.
Mhm.
Gosh. Lower impact than basketball.
Mm-hmm.
Oh. Okay. Gosh, you're getting Mintonette. Okay.
I'll give you a clue. And I came up with this one. I was also thinking of doing sports trivia and calling it VU Sports Trivia because all the answers started with V.
Was it volleyball?
It is
Really?
volleyball.
Yeah,
Very good. Okay. Yeah. That's the only one that starts with V.
Yes.
That's why we didn't go with that. Okay. Next question. What animal is the official mascot of the Olympics?
I didn't know they had.
I didn't either.
That is correct. There isn't one.
Oh.
Yeah. Yeah. So each host city gets to
That's what I
pick
thought.
its own mascot. So
I didn't even know there was a mascot in
yeah.
general.
So like
Okay.
in the 80s,
Yeah.
the Russians had a bear named Misha, right?
Okay.
I thought it was Flavor Flav.
Yeah. Yeah.
He's the new mascot,
in
isn't
the last one, it was a dog. I think it was Snoop Dogg, right? Yeah. Right. So
Oh God, yeah, he was there a lot.
dude, he's great on the
Yeah.
Olympics.
Oh my gosh.
Yeah, so I'll sign up for that. All right. In golf, what is the term for scoring 3 under par in a single hole?
Oh, I should know this case. Is it albatross?
Yes.
Nice.
Killed it. Yes.
Nice.
Yeah, I get lots of albatrosses, so I did that one. Yeah. Tiger Woods golf. So which sport includes the terms axel, lutz, and salchow?
Figure skating.
Yes, very good. All right. You know your sports. And if you don't get this next one correctly, I don't know if you are a true beaver.
Oh no.
In what sport might you perform the Fosbury flop?
The Fosbury flop?
The Fosbury flop. Oh no. Oh no.
Oh, it is.
You got it.
Yeah. Diving.
Ooh. Well, it's kind of a similar
Sort of.
motion,
You're
but
flopping.
it's named after Dick Fosbury,
Oh,
who was an Oregon State Beaver, and
Okay.
it is the high jump.
it's the high jump.
Yes.
Ah,
So
yes, okay.
the Fosbury flop
Okay.
is the backwards jump over the bar. So before that, everybody was like doing kind of a scissor
Face
kick.
first.
Yeah, or
Oh,
kinda
the
rolling.
scissor kick, right.
Yes, but Dick Fosbury made it popular because he was breaking records by going with the lordosis and the lumbar spine.
To what we know as now,
Yeah.
right?
Yeah.
All the
Yes.
techniques. now.
Everybody's doing the Fosbury
Yeah.
flop
There's
now.
a statue in front of Dixon.
There is.
Yeah.
I did not know that. Wow.
Yeah, and he just passed away, I think
Oh,
like a
did he?
year or two ago. Yeah, but awesome guy, great ambassador
R.I.P.
for Beaver sports.
Wow.
All right, here's an easy one, I think. Which athlete famously said, "Float like a butterfly, sting like a bee"?
Muhammad Ali.
All right, very good. What is the only major sport that has been played on the moon?
Golf.
It is. All right, very
Hey,
good.
wow.
Yeah. Alan Shepard made his own like 6-iron out of some
Really?
equipment. Yeah. Which piece of equipment was originally made from a pig's bladder?
The football?
Very good. That's why we call it the
Pigskin?
pigskin. Very
Oh.
good. And I think that you'll get this one just because I read some of your hobbies. Which two sports are combined in the Olympic event called biathlon?
Oh, it's cross-country skiing and then and shooting, right?
Very good.
Yeah.
Yes.
Yeah.
Because you are a skier. Yes.
Yeah.
All right.
Gotcha.
Very good. All right. Well, man, he killed it.
He did.
Yeah. I was writing this stuff up and I was like,
That's
oh,
Those
no.
are hard
That's
questions.
an A.
That was
Yeah.
those
Yeah.
are hard
Yeah.
questions.
No,
Yeah.
this
Well
you
done.
proved that this is VU sports trivia. Right. It's a whole category of sports trivia now.
Cool.
No. Well, hey, I really appreciate you being here. This is
Absolutely.
I
Thank
think
you
this
for
is a
having
real
me.
treat.
Yes.
Yeah, there's I mean, most of the time we're talking about this stuff. It's just a
Yeah,
bunch of stuff I
freaking
already knew.
boring.
We're so me and Kathy are so freaking smart. So freaking smart. But this was like I'm gonna count this as continuing education.
Yes, no
yeah.
doubt.
No.
You
It was-
should submit it.
yeah.
See what they say.
Yeah, exactly. There we go. This was really informative.
Mhm.
You gave us some stuff that I'm definitely talking with patients about
Oh, no
tomorrow.
doubt.
Because we have to go to work tomorrow.
Yeah.
But yes, if anybody is interested in getting in touch with you or anything like that, like how do people locally get in touch with you, or how do they get in at Samaritan Athletic Medicine?
Usually, I mean, like we're on the Samaritan website. I'm on
Okay.
there too, and so happy to see anybody that wants to talk and
Mhm.
about any of the stuff that we talked about or anything else, right? And so that's probably the easiest way, and I can share my contact info with you too. And so
Awesome. Yeah, the man's got a lot of needles, and they're all full of good stuff. So.
They Full of the good stuff.
Yes, Kathy, take homes.
Take home. Yeah. I was gonna ask the question why I don't see the visco supplementation in other joints, and you kind of answered that.
Yeah.
So now I know, because there's definitely some shoulders that I see are just so
You think-
much
yeah.
impetus in
Yeah.
there and just super painful. And I think, gosh, there's got to be something other than cortisone.
exactly.
But right now, no.
Yeah, I'm not covering it.
And I learned something about cortisone shots. Actually, I was misinformed or maybe misremembered, but I thought that people shouldn't get over 3. Period. But you said it was more than 3 in a year, which I think that's good, useful information because I've been lying to people. Apparently, it's not a lie if I just didn't know, right? No. But yeah, this is awesome. I think it's one of our best episodes
Oh,
yet.
no doubt.
Yeah, when we get that platinum YouTube plaque, we're gonna have to have you come sign it. Okay. Speaking
I
of
could talk about this for hours.
yeah,
so,
totally.
yeah.
Yeah, we might have to have you back.
Yeah.
Oh, happy to
Yeah, I got a lot
come
of
back. I
questions.
appreciate the invite, guys.
Yeah.
Yeah. And speaking of our platinum YouTube plaque, make sure to like and subscribe. We love your comments. We love a great review on Spotify. We want you to share this with all of your friends who are hobbling and limping around, or who have questions about this, because it's a really useful thing to know
Really
about.
is. Yeah.
There are people whose quality of life sucks right now
Mhm.
because they're afraid of this thing just because they don't know about it, right?
Right.
And so there's people who have decided that I'm not going to play with my kids anymore. I have to quit my job.
Right.
I'm going to give up my sport. No
Mhm.
more pickleball for me.
Right.
And it's because they don't understand some of these options that are out there. And
right.
so hopefully this is going to make somebody's life better by
Yeah.
hearing about it. So
Yeah.
thank you very much.
Thank you very much.
Yes. And I think that there's one really important thing that we cover every single week, though. Maybe the most important point that we can make is that there's no I in pitch.